Hello everyone, welcome to Policy Perspectives. Today we have students of St. Joseph's University to enlighten us about a very important topic. India is suffering. India is suffering from a disease called unemployment and how our youth is getting affected by it. The mental health of our youth is getting affected by it. So I'm your host Akshata Malik, and we have students here to enlighten us on this topic. So tell me about it, elaborate on it.
Now, since we'll be discussing unemployment of youth in India and mental health in India, let's first look at unemployment in general first. Now, the unemployment rate of individuals in India is 3.2%, but it fluctuates throughout the year, as we will explain later. Now, according to the Ministry of Labor, as I said, it's 3.2%. But COVID-19, which is a very recent outbreak that happened in the year, which had a huge impact in the year 2020, caused a large amount of mental health issues along with unemployment. In the youth, about 27 million young people lost their jobs in April 2020 alone, which, as you can expect, has a huge impact on mental health. This is according to the Center for Monitoring the Indian Economy. 320 million students were affected by the closing of educational institutions and postponement of exams, according to UNESCO. Along with this, 6,000 youths took a survey, and in that, 37% of them said that they had issues with mental health, and COVID had affected that as well. Again, according to the Center for Monitoring the Indian Economy.
I'm pretty sure our listener would like to know about what our government is doing in order to eradicate unemployment.
Now, we have to acknowledge that the Indian government, the central government, is implementing schemes to reduce unemployment, especially in rural areas. For example, Manreka and ABRY. We're going to look at ABRY specifically because it deals with the effects of COVID on unemployment. ABRY is Atmanirbhar Bharat Rojgar Yojana, which happened after COVID about 2021. It gave both subsidies to companies regarding employment of new employees. It gave a percentage of these new employees' salaries so that it boosts the economy. They also gave subsidies, their monetary aid to individuals with less than 15,000 rupees of a salary, even if they have found employment and even if they didn't find employment. This is to boost the economy, essentially. This is all according to a press release by the central government. Regarding the impact of this scheme, the Labor Ministry said that 60.5 lakh individuals were affected by this scheme positively. Along with this, 1.5 lakh institutions or establishments that employ these individuals were also benefiting from this scheme with the subsidies that the government does give them. So we can say that this scheme was effective.
There's an impression among us, among the society, the societal stigma that mental health is not regarded by the government. What do you have to say about that?
Now, regarding this, in 2014, the central government was aware of the problem of mental health disorders and how big it has gotten because the WHO themselves criticized the central government's inactions regarding this. So they put out a scheme in 2014 called the National Mental Health Policy of India. This provided universal access to mental health care in every level, from the community level. It also aimed to reduce the social stigma associated with mental health in the country. Unfortunately, in a study by Snehal Gupta and Rajesh Sagar, they found that the training by the government for mental health practitioners on a community level were quite meager. There was no collaboration with NGOs or welfare groups. There was no communication between the legal system and civil societies regarding mental health and the impact it can have on the population. And overall, it just lacked funding on a community level as well, which is grassroots level. It affects everyone. Because of this, the scheme itself was deemed a failure by these researchers. And COVID-19 did increase mental health issues within the country itself, which is why this scheme has failed. One other flaw that we noticed when researching this topic was the central government and other state governments simply do not account for the youth when it comes to unemployment or mental health. They do not target the youth, they target the general population, which in and of itself is a flaw due to the extreme vulnerability that the youth has regarding mental health and unemployment.
You mentioned something about the fluctuation in the rate of unemployment. What do you mean by that? Yeah, so I'm sure we are familiar with the statistics that most Indians are involved in agriculture and they work from either July to October or October to March, depending on the area. And once the harvest is done, they have no work and no money. And thus, they labor on other fields or migrate to another region. This is what is called seasonal migration, and this is mainly due to rain fed agriculture, which means most fields are not artificially irrigated. Once they migrate from rural to urban areas, they get employment on the basis of their skill and education level. And since most of these migrant workers are from poor, uneducated backgrounds, they either go into manual labor or low paying jobs. How do you think it is actually distressing people? What do you have to say about it? Well, let's take an example of construction work. Construction work in India is not organized like in the US. So once the work is done, they have no insurance, no benefits, no money, and they're left in an unfamiliar area and they're forced to go home or find a job. According to Labor Ministry, 14% of migrant workers are the sole breadwinners of the family and they are paid less and the place they are living has high cost of living. What do you think can be done in order to ensure the mental health of individuals?
Well, I believe that we have to look at unemployment and migration separately. Now, in the case of migrant labor and a general youth who has lost their job due to the unforeseen circumstances, union should be formed. Essentially, ensure that these individuals will log in and register for the hours that they have worked, providing willingness to work and usefulness to the society. Once this is done, government will be able to give these individuals the benefit that they have to get if they are employed or even if they are unemployed. It would be mandatory health insurance. Part of this health insurance should include the mandatory counseling sessions that by the government, which would assist in improving overall mental health of these individuals along with the mandatory aid from their previous salary. This very same system has been implemented in many countries such as Norway and Luxembourg in order to ensure the safeguard of the lives of these unemployed individuals.
Mental health counseling and the topic of mental health is a taboo in itself, especially for the uneducated sector. And many psychological experts themselves say that there is low rate of self-reporting, while counseling mandated by the government will be enough.
Well, regarding the counseling and the topic of mental health, I think that we must de-tabooify the concept of mental health itself. Mandating teaching of mental health to students in schools is essential in order to make them stable for their future endeavors. Government mandates for counseling, starting in high school itself, would help get students get comfortable in discussing mental health issues in public. Parent teacher meetings, in which they are educated on the importance of mental health, would help them develop a better relationship with mental health as well as ensure that the student's adulthood goes well. In rural areas, temporary camps can be set up with the help of mental health professionals, and that I think would help foster a better understanding for mental health in India.
With this, we come to an end. Stay tuned, stay informed. See you in the next episode.